Thorax, surface anatomy, anterior chest wall, the heart, and great vessels. The anterior chest wall extends from the clavicles to the costal margin. It is formed by the ribs and costal cartilages, the sternum, and the associated muscles. The two sides of the chest are usually symmetrical. The sternum is made up of the manubrium, the body, and the xiphisternum. The suprasternal notch on the superior aspect of the manubrium is palpable. The manubrium and the body of the sternum are also palpable throughout their length, and they are united by a secondary cartilaginous joint, forming the sternal angle of Louis. In the midline, palpate the suprasternal notch at the upper end of the manubrium and between the prominent sternal ends of the clavicle. Palpate the trachea in the suprasternal notch on either side of the midline. Slide your fingers down the midline for 5 centimeters until they encounter a transverse ridge where the manubrium meets the body of the sternum at the sternal angle of Louis. The sternal angle of Louis is at the level of the 4th thoracic vertebra. It forms an important landmark for the description of structures inside the chest. Ribs are counted from this site as it is consistently palpable. Second costal cartilage. The second costal cartilage articulates on each side at the sternal angle of Louis. Palpate the sternal angle of Louis and the second costal cartilage and count the ribs downwards. Slide your fingers down the midline about 10 centimeters more to the next transverse ridge, the lower end of the body of the sternum, the xiphisternal joint. Palpate the xiphoid process gently. It may be tender. Vertebral levels. The suprasternal notch is at the level of the 2nd thoracic vertebra. The sternal angle of Louis is at the level of the 4th thoracic vertebra. The xiphisternal joint is at the level of the 8th thoracic vertebra. The heart. Borders of the heart. The heart has the following borders: the right border, the left border, the upper border, and the lower border. The right border of the heart extends from the 3rd right costal cartilage to the 6th right costal cartilage. The left border of the heart extends from the 2nd left costal cartilage to the 5th left intercostal space in the mid-clavicular line. The lower border of the heart is located from the 6th right costal cartilage to the 5th left intercostal space mid-clavicular line. The upper border of the heart extends from the 2nd left costal cartilage to the 3rd right costal cartilage. Heart valves. Pulmonary valve. The pulmonary valve is located at the 3rd left costal cartilage retrosternally. Aortic valve. The aortic valve is located at the 3rd left intercostal space retrosternally. The mitral valve. The mitral valve is located at the 4th left costal cartilage retrosternally. The tricuspid valve. The tricuspid valve is located at the fourth right intercostal space retrosternally. Auscultation points. Pulmonary valve. The pulmonary valve is best heard at the second left intercostal space. Aortic valve. The aortic valve is best heard at the second right intercostal space. The mitral valve. The mitral valve is best heard at the fifth left intercostal space mid-clavicular line. Apex beat. Palpate the apex beat at the fifth left intercostal space in the mid-clavicular line. The tricuspid valve. Tricuspid valve is best heard at the fourth left intercostal space. Superior mediastinum. Surface anatomy. The superior mediastinum is located above the sternal angle of Lewy. Outline the great vessels. Sternoclavicular joint. Formation of brachiocephalic veins. The left brachiocephalic vein runs obliquely from the left sternoclavicular joint to join the right brachiocephalic vein behind the first costal cartilage. First costal cartilage. Formation of superior vena cava. Second costal cartilage. Azygous vein drains into superior vena cava. Third costal cartilage. Superior vena cava drains into right atrium. The arch of the aorta begins and ends at the sternal angle of Lewy. The pulmonary trunk and its right and left branches lie below the aortic arch.